Hello everyone, this is Dr. Shuvo and today we will study gallbladder pathologies. The normal gallbladder has an anechoic lumen with the hyperechoic walls, and here is the neck of the gallbladder, and over here is the fundus of the gallbladder, and central part is the body of gallbladder, and this is the transverse view of the gallbladder. And the Friesen cap is a normal occurrence in the gallbladder in which the fundus will fold on itself. It is actually not a disease but just an occurrence. A multiseptated gallbladder gives a honeycomb appearance, which look like these multiple septations inside the gallbladder, and they are asymptomatic, but they should not be ignored because they may lead to malignancy. The next one is the contracted gallbladder. It occurs when the person has recently eaten and the walls may appear thicker than the normal. But as you can see, it is less than 3 mm. It is the transverse view of the contracted gallbladder. The next one is the complete gallbladder duplication. Here you can see two separate gallbladder in this image. The another one is the partial gallbladder duplication. In partial duplication of the gallbladder, the body and the neck are common. But here you can notice one fundus is over here, another fundus is over here. Next one is the gallstone. The gallstones appear as hyperechoic structure inside the gallbladder, and they will produce the posterior acoustic shadowing. In this image, there are 4 gallstones and each one is producing its own shadow posteriorly. Here are the shadow. The next pathology is the wedge sign. The wedge sign stands for the wall echo shadow sign. It occurs in a gallbladder and that is completely filled with stones. The first layer that you can see is the gallbladder wall, and it is slightly hypoechoic, followed by the hyperechoic layer, and that layer is full of stones. And behind that or below that, that is the posterior acoustic shadow. Next pathology is the gallbladder sludge. The gallbladder sludge is the thickened form of bile and it has increased density, so that is why it is appearing hyperechoic without any posterior acoustic shadowing, and it is mobile. That is when the patient shifts his position, the sludge will also change its position relatively. Here is the transverse image of the gallbladder showing sludge which is hyperechoic due to the thickening of the bile. Next one is the acute cholecystitis. Acute cholecystitis is the inflammation of the gallbladder. The first sign is the thickness of the gallbladder wall, which is more than 3 mm. In this transverse view, we can see the thickened wall, and even there can be presence of the gallstone with the gallbladder sludge as well. And another important sign is the presence of the pericholecystic fluid. In this image, you can notice the pericholecystic fluid is over here, fluid outside gallbladder. The acute cholecystitis longitudinal view. Another sign is the sonographic Murphy's sign. It is helpful in diagnosing cholecystitis. In this, the pressure is applied with the transducer while scanning the gallbladder, and while applying the pressure, the patient will feel pain and the tenderness, and that is a positive Murphy's sign. The next one is the gangrenous cholecystitis. Gangrenous cholecystitis is a severe case. In this case, the wall of the gallbladder will be disruptions. There are also may presence of sludge membrane and as well as the presence of wall ulcerations. In the transverse view of the gallbladder, you can see there is a wall ulcerations. And here is the longitudinal view of the gangrenous cholecystitis. There is 3 ulcerations present here. Next topic is the gallbladder perforation. Gallbladder perforation is the large defect in the gallbladder wall along with communicating the pericholecystic fluid. In the longitudinal view of the gallbladder, you can see clearly there is a defect in the gallbladder wall. Pericholecystic fluid is a strong sign of the gallbladder perforation. Next one is the gallbladder polyps. Polyps are masses attached to the gallbladder wall by a stalk, and here you can see the mass is attached to the gallbladder wall, and this is also known as ball on the wall sign. Here you can see the polyp is attached to the wall of the gallbladder. Here you can notice in the longitudinal view the multiple polyps are attached to the gallbladder wall. Next topic is the adenomyomatosis. Adenomyomatosis occurs when there is a herniation of the mucosal layer of the gallbladder wall into the muscular layer of the wall, and this can form with a sinus or pocket, and these sinus or pockets known as the Rocketensi Ascorp sinus. And the cholesterol crystals can get deposited here, which will give comet tail artifact, and they will look like this. This is the comet tail artifact. This is the transverse view of the adenomyomatosis. Next on is the gallbladder cancer. Here you can see the hypoic and the heterogeneous mass attached to the gallbladder wall, and this can also lead to thickness of the gallbladder wall, and it also may be infiltrating into other structures such as the liver. Here is an image of the wall thickening due to hepatitis. Here you can see only wall is thickening and no other feature is seen, such as the gallstones, sludge, etc. This is the another image. This is the longitudinal image of the gallbladder. The wall is extensive thickened. So it is an image of the cholecystitis due to hepatitis. Wall will be thickened extensively. The next one is the porcelain gallbladder. Porcelain gallbladder presents as the calcification of the gallbladder wall, and we will see the hyperechoic gallbladder wall with the posterior shadowing. Here is the gallbladder wall, which is hyperechoic, and here is the shadow, that is the posterior acoustic shadow. Here is a transverse view showing the hyperechoic wall with posterior acoustic shadowing. And that is it. Thank you so much for watching my video. Please subscribe and stay tuned for more amazing video. Thank you everyone.